So, what is celiac disease? Well, celiac is also known as gluten-sensitive enteropathy. This, however, is different from simple gluten sensitivity, which doesn't damage the small intestine. Celiac affects 1 in 100 people, and it is a chronic genetic condition caused by an immune reaction to gluten, a protein plentiful in all grains, but especially in corn and rice. Molecules that form as a result of the breakdown of gluten interact with molecules of the immune system in the GI tract to form complexes. These complexes activate T cells produced by the thymus, which then attack the intestinal lining, damaging intestinal villi and reducing the surface area of the brush border. As a result, bloating, diarrhea, pain, and malnutrition can occur.
According to the Celiac Disease Foundation, about 1% of the world population has celiac disease. The rates are highest in South America, with almost 4% of South Americans having the disease. The United States rates are lower than worldwide, with about 0.7% of Americans experiencing celiac. It shows up more often in females than in males, and females have celiac about twice as often as males do. Of these numbers, it's estimated that about 80% of all celiac sufferers in America go undiagnosed. So as you can see on this graph, the prevalence of celiac has gone up significantly over the past few decades. The incidence was about 0.2% of the population in the late 1980s, and the rate has gone up to over 1% as of 2015. This could be due to several reasons, including changes in gluten content in commercial breads and changes in the amount of and the identity of antibodies that we're exposed to, according to Dr. Stefano Guadagnini of the University of Chicago's Celiac Institute.
Celiac disease affects the overall health of an individual in numerous ways. The first way is with nutrient malabsorption. This affects both children and adults. In children, it may lead to poor growth, low body weight, muscle wasting, and anemia. In adults, it may lead to the development of anemia, bone disorders, neurological symptoms, and fertility problems. For women, these fertility problems may affect the menstrual and reproductive systems. Women may experience later menarche, earlier menopause, secondary amenorrhea, recurrent miscarriages, infertility, preterm delivery, and low birth weight. Despite all of these possible changes, the fertility of a woman stays about the same, and it's mostly unaffected by celiac disease. A male may experience abnormalities in sperm motility and morphology. Individuals with celiac disease are at a risk for developing a wide variety of other illnesses, including type 1 diabetes, autoimmune thyroid diseases, liver disease, inflammatory bowel diseases, and intestinal cancers. Some neuropsychiatric diseases have also been noted in celiac patients. The celiac patients have been associated with symptoms including a headache, ataxia, or a loss of full control of body movements, depression, dysthymia, which is a mild but long-term form of depression, anxiety, epilepsy, and peripheral neuropathy, which is a burning, tingling, or numbness in the hands and feet. Peripheral neuropathy has been described in up to 50% of patients with celiac disease. These signs may also precede the diagnosis of celiac disease as well. Neuropathies may be associated with deficiencies in some vitamins, including vitamins B and vitamin E. A gluten-free diet has been a favorable effect on headaches and dysthymia, but it has not shown to improve peripheral neuropathies in these patients. One study also showed the structural and functional brain deficits caused by celiac disease on an MRI, but this has not been done many times, so it's not a common finding. Arthritis has also been seen in celiac patients, but it's unclear whether there is a causal relationship between osteoarthritis and celiac disease. Iron deficiency anemia can be a frequent effect of celiac disease, as well as reduced cardiac function, including myocarditis and cardiomyopathy. Atrophic glossitis, or oral lesions, and pancreatitis may also be associated with celiac disease. Osteoporosis is a risk if the client is left untreated. The small intestine would not absorb calcium, which keeps your bones strong, so this would result in low bone density. This may be considered a silent disease because it can progress for years without showing symptoms until one day you get a fracture and then you're diagnosed with osteoporosis. Some patients may react to celiac disease by developing a severe itchy rash known as dermatitis herpetiformis. Some patients have an increased cancer risk. The strongest risk is for developing lymphoma and gastrointestinal cancer. Celiac disease is also closely associated with type 1 diabetes, like I mentioned earlier, and it's possible that the two share multiple genetic loci and genetic variations. This suggests that type 1 diabetes and celiac disease have common features in their pathogenesis, such as tissue damage or intolerance to dietary antigens. There's also a strong association between celiac disease and Down syndrome patients. 16% of these patients have celiac disease, which is a 20-fold increase compared to the general population. Some consequences of living with celiac disease. One of the major and probably most obvious consequences includes a lifelong adherence to a gluten-free diet. The patient must eliminate wheat, barley, and rye from their diet, anything containing gluten. Reading food labels carefully now becomes a major part of their life. And one problem is that some foods are not always obvious whether they contain gluten or not. Some of these include salad dressings, soy sauce, some medications, malt syrup, imitation meats, communion wafers, coffee substitutes, caramel coloring, beer, and brewer's yeast. Patients must be careful to prevent cross-contamination from utensils, cutting boards, and toasters that are shared with people that are eating gluten. One problem is that their diet may become monotonous or dull and repetitive. It can be tricky to avoid that. And being gluten-free can also become a social liability. It can restrict lots of food choices in restaurants and in visiting friends. If they're all eating a dish together that has gluten in it, then you're forced to not eat it with them. And traveling can also become more difficult when you have to get that food on the go. Mucosal healing in the gut can take up to years, so the recovering of the intestine can take a very long time. And while the intestine's recovering, it's important to avoid milk, cheese, dairy foods, and others during this time because it's harder to break them down. Dietary supplements can be taken to meet micronutrient needs.
There is no permanent cure for celiac disease. While there are no medications or treatment that patients with celiac can take to completely eliminate disease, there is still a way to minimize and alleviate some of the symptoms and problems by going on to a gluten-free diet. This diet helps people with celiac because it minimizes the amount of gluten the patient consumes. This is important because gluten is known for irritating the small intestine. So once they're on a gluten-free diet, it can help with healing the small intestine, and also with preventing further damage. Moving from a normal diet to a gluten-free diet can be challenging. It's not easy to make this switch because so many of the common foods you eat on a daily basis contain gluten. Luckily, there are dietitians and doctors who specialize in treating people with celiac disease and can help make this transition easy from going to a gluten diet to a gluten-free diet. Let's take a look at what this looks like. The first step to creating a gluten-free diet is to be educated on what food products contain gluten and what food products do not. Common foods that contain gluten include things like pasta, baked goods, beer, bread, cereal, and crackers, and things with rye, wheat, and barley in it. These foods may make it seem like it's a lot and it's hard to go from a gluten diet to a gluten-free diet, but there are also a lot of naturally occurring gluten-free foods and manufactured gluten-free foods that the patient can eat. Let's take a look at some of these options. Some naturally occurring gluten-free foods include fresh fruit, vegetables, dairy products, rice, meats and seafood, corn, quinoa, and potatoes. Besides these naturally occurring gluten-free foods, there are also a lot of manufactured gluten-free foods that people can enjoy for breakfast, lunch, dinner, and even dessert. To find these gluten-free products, patients with celiac disease can look for the gluten-free label on food. According to the FDA, all products labeled gluten-free, free of gluten, or without gluten must contain less than 20 parts per million of gluten. This amount of gluten is so small that it is tolerable for people to eat. If you're unsure on what may have gluten in it or not, patients can also look at store management, restaurant, dining menus, and apps.
So, why is this topic relevant to nurses? Well, like we stated earlier, about 1 in 100 people have celiac disease, 1 in 100 Americans, although most don't actually know it. Compared with the entirety of the American population and the statistical likelihood of the disease occurrence, chances are quite high that during practice as a nurse you will encounter someone with celiacs. Aside from knowing this, it's also important for the nurse to know what sorts of people are likely to have or develop celiacs based on current statistics, simply because of the fact that many people are uneducated about the disease and do not recognize the link between the ingestion of gluten and its negative side effects on the body, specifically in the case of celiacs. Celiacs affects both adults and children worldwide, but data shows that it's more common in Caucasian females. According to the NIH, people with other diseases such as Down syndrome, Turner syndrome, and type 1 diabetes are more likely to have or to develop celiac disease. In knowing this, the nurse should be on the lookout for adverse reactions in these specific populations. Lastly, people with celiacs may also be at risk for other diseases such as Addison's disease, Hashimoto's disease, primary biliary cirrhosis, and type 1 diabetes.
Okay, so this is Brenna. She has celiac disease, and she's just going to help answer a few questions we have for her. So first, to get started, how long have you had celiac disease?
I was originally diagnosed with celiac 12 years ago when I went in for some allergy testing, and my naturopath at the time recommended that I get a celiac test done.
Okay.
Are you on a gluten-free diet right now?
I am. So everything that I eat is pretty regulated. I strive to get no gluten or contact with gluten in my diet as much as possible, but sometimes there's slip-ups. But everything that's in my apartment that I eat is gluten-free.
So is it hard to find gluten-free options on campus at all, or just around?
Yeah, so I am originally from Seattle, and so moving here was definitely like a learning curve in terms of availability for gluten-free products, as well as some other allergies that I have to navigate. In my freshman year, Carol did an awesome job at the Stack providing gluten-free options for people. And the last couple of years, there's been a little bit less options for us. But since moving to the apartments, I have kind of taken my own dietary needs into my own hands, and so I do my own shopping, and I don't eat as much on campus. And Helena is definitely like becoming more accommodating to people with allergies, and so I'm finding it easier over time to find places that offer gluten-free choices and stuff like that.
Awesome. And then what are the costs to being gluten-free? Like, is it a lot more expensive than normal diet?
Yes and no. I substitute a lot of like needing to buy gluten-free things with just other options for like carbohydrates and stuff like that. But for the most part, if I'm trying to buy like things that are certified gluten-free or that they like don't have options for, then it is more expensive. Like having to buy certified gluten-free cereals always like marks up the prices on things like that. Pastries, there's always a charge. Going to restaurants, having gluten-free bread on sandwiches or buns, there's always like an additional markup. But at the end of the day, I think it's less costly than if I were to eat it and I get super sick. So
That makes sense.
What happens if you decide to eat gluten or if you accidentally eat gluten?
yeah. So some of my like symptoms that I know if I've eaten gluten is I get really bad migraines is a big one, as well as I get really severe bloating. And so that's something that both of those things are huge indicators for me that if I have accidentally had something that was in contact with non-gluten-free foods or somehow missed something in an ingredient, both those things come on normally within 24 hours of eating it, and so I know from there that I probably can trace back to something I ate.
How long does that usually last for? The headaches, the migraines, or the bloating?
So the migraines, I have migraine medication that I can take for that, and that just kind of helps bring it down to a more manageable level. And so normally those don't last for any more than like 6 hours. They aren't debilitating past that point. The bloating normally can range from like 45 minutes to I've had like multiple day bloating that's pretty severe that has actually caused me to go to the hospital a couple times. But that's more if like something was mixed up at a restaurant and I ate like a full meal of gluten filled food rather than just like trace elements of it.
Okay, and then our last question for you is there something about having celiac that would surprise people or a lot of people don't know about celiac disease?
I think, I don't know if there's anything that I would say that surprise people. There is like a lot of, I guess, doubt when I tell people like, yeah, I'm gluten-free or I have celiac. Like I normally get bombarded with questions like, oh, are you actually celiac? Like, do you actually need to eat gluten-free or are you just one of those like hippies that want to try the gluten-free diet? And so I think there's, I wouldn't necessarily call it stigma, but I guess there's a lot of discussion around it, and that's something that I just have to continue to navigate. And normally I'm just like, yes, I am actually have celiac. Like I can't just choose to eat gluten some days and choose not to. And I think that label is thrown around a lot more frequently than people intend to. And so I think that sometimes it's given it, or it's misrepresented, the disease in our community. So yeah, but if there's, I don't really have any surprising facts or anything about it.
That's
so
okay.
Yeah.
Well, thank you.
Yeah.
I was wondering, what can you do for students with celiac disease at the Stack? Like, what are their meal options, and how can we accommodate them here?
So this year we started the Simple Servings program. So everything on this line is all, it eliminates 8 of the major allergens, which celiacs and gluten is a major allergen. So we take a lot of care in the back to make sure that we don't cross-contaminate anything or anything like that. We use all kinds of different utensils and stuff like that to make sure that we don't cross-contaminate. So anybody can eat out here that has celiac or anything like that is completely safe. They can feel safe when they eat here. They don't have to worry about it.
Cool. And is there anything else you guys do besides this, or?
So this is the safest spot as far as like that goes, because when we're prepping anything else in the kitchen, we're not, we're prepping this just for that reason. But in the other parts of the kitchen, we're using other ingredients and stuff. But we do have our gluten-free area that we're going to try to expand next year with more gluten-free options as far as like the cookies and stuff like that. So, other than that, salad bar, everything in here, we always tell everybody, anything outside there is not necessarily 100% gluten-free because I don't know if somebody's cross-contaminated that. If somebody's going through the salad bar and they drop a crouton into the salad, I don't know that. So everybody always has to be aware of that.
Awesome. Thank you.
You're welcome.
So how do we as nurses utilize this information? For starters, simply just being aware of the prevalence of this condition within the American people is a good start, as well as realizing that the poor condition of a patient isn't always due to endogenous factors, but also other factors such as allergic reactions, or in this case, diet, which is what stimulates an autoimmune response. So as nurses, we should recognize the top symptoms of celiac disease, such as bone loss, anemia, liver disease, diarrhea, bloating, canker sores, irritable bowel syndrome, constipation, acid reflux, and recurrent miscarriages. And those last ones aren't as common. I'd say that they're about the 10% to 20% of all people with celiacs experience this, but they still exist, so we should be cognizant of that. And then furthermore, we need to be on the lookout for other risk factors, as mentioned earlier, such as primary biliary cirrhosis and type 1 diabetes, because having celiacs makes it more likely to develop, say, type 1 diabetes. And these are all interrelated systems.
Since patient education is such a big part of our role as nurses, I think that one way we could implement this information in patient care would be to educate parents with children that have celiac disease on creative ways to implement the gluten-free diet while still keeping their children healthy and fed, and also giving our patients recipes for gluten-free snacks and treats so that they can enjoy their meals while also following the gluten-free diet.
As a nurse, I would provide patient education to patients with celiac disease. I would inform them on foods that they should avoid, such as anything containing barley, wheat, or rye. I would also offer suggestions of what the patient can safely eat. I would do this by providing a sample menu with creative meal ideas to help the patient to be more excited about their new diet that might be difficult to adjust to. For example, I could offer them this recipe for scones that look delicious and are also gluten-free.